Hello everyone. In the previous lecture, guys, we talked about the oral cavity and the different structure there, and today we'll continue to talk about the salivary glands, and I'm expecting to talk to you about submandibular, sublingual, and parotid glands. So let us start, guys, with the submandibular gland, but before that, let us identify the what known as submandibular region, the region that's under the mandible or so. Look at it here. This is the body of the mandible, as you see, guys, and this is the hyoid bone. If you look here, guys, anteriorly, there is a kind of a small pili or pili muscle, which is known anterior pili of the gastric muscle, this one. And here is the posterior pili of the gastric muscle. So we have anterior one and posterior one attached to each other by intermediate tendon. However, so we have the lower border of the body of the mandible, we have the hyoid bone, we have anterior pili of the gastric muscle, and we have posterior pili of the gastric muscle. So this region is the submandibular region. Look at it. There is a kind of a gland here. This is the submandibular gland. So look at it, this, guys, the half of the mandible removed in order to show you the couple of structures there. And here in the right figure, you are looking to the mandible from behind. Look at here, there is a muscle here, which is important muscle. This muscle, guys, is the mylohyoid muscle. Is attached to the mylohyoid line of the mandible from one side and fuse with the in the midline with the other muscle as well to form the floor of the oral cavity. Look at it here, attached here and here as well, and to the hyoid bone, of course. That's why it's known as mylohyoid muscle. However, it forms like the floor of the oral cavity. Now, if you focus, guys, here, you will see here there is a gland. This is the submandibular gland. It's like a hook shape. It's like a hook shape. But part of it, this one, is superficial to the mylohyoid muscle, and another part of it is deep to it, which is like that, right? So this part is deep and this part is superficial. For example, guys, here you are looking to the superficial part, right? Okay, here also, this is the deep part of the gland, and continue here, the superficial part. Okay. So what we have to know about the submandibular gland. So although it's for histology, but you have to know that it's a mixed gland. That means it has serous and mucus acini histologically, and it's located beneath the lower border of the mandible, as I show you here. And guys, it's divided into deep part and superficial part, which is related, of course, to the mylohyoid muscle. That means the mylohyoid muscle divides this gland, the submandibular gland, into deep part and superficial part. Okay, now look at the deep part, guys. The deep part, it's just located beneath the mucous membrane of the mouth. maybe here, guys. Look at the mucous membrane. This is the mucous membrane of the mouth. So the deep part is located just beneath the mucous membrane at the side of the tongue, right? Let us go back. Here is the deep part. So these are muscles of the tongue. So you can say, okay, this is your tongue. So it's just to the side. It's located. The deep part is located just to the side of the tongue, beneath the mucous membrane of the floor of the mouth. And let us look at the deep part, or the tip of the deep part. Okay, this is the deep part, guys. And from the anterior end of it, there is a kind of a duct that emerges from there. So from the anterior end of the part of the submandibular gland, you would see that there is a submandibular duct. Look at it. Emerge there. Again, this is the submandibular duct that opens. Of course, it's running beneath the mucous membrane also, and it's open near the frenulum of the tongue. You remember from the previous lecture that this is fold of a mucous membrane that fixes the ventral surface of the tongue to the floor of the mouth is known as a frenulum of tongue. This is the frenulum of tongue, guys. So, and we have, as we mentioned, two openings. These are the opening of submandibular duct. Shift to the relations of the submandibular gland. As I mentioned earlier, first of all, it's located in the submandibular triangle. This triangle is submandibular triangle. Also, it's known as the gastric triangle because it's located between the anterior belly of the gastric and posterior belly of the gastric. That's why this triangle is known as the gastric triangle or submandibular triangle. So, first of all, the submandibular gland here is located, it should be here, but it's removed. So it's located in the submandibular triangle. This is the first one. Don't look for this gland. This is another gland. This is the parotid gland, right? So forget it for now. We'll talk about it later. So our target is this gland, submandibular gland. Now you are looking to the superficial part of that gland. Now, important relation, guys, to the submandibular gland. First of all, look at it here. There is a skin. Deep to the skin, there is a thin fatty layer, which is the superficial fascia, this one. And of course, it's extended down, guys, right? But I'm trying to show you the relations of that gland. Of course, I'm talking about the inferolateral surface. That means what's the relation of the gland from this side, right? From this area. Inferolateral. Laterally and inferiorly. So we have, guys, the skin, of course, and deep to skin there is a superficial fascia, a thin layer of fatty tissue. What's interesting here, that in the neck there is a thin muscle known as platysma. You can Google it, guys. This platysma embedded in the superficial fascia. That means it's located here, right? And of course, it attached to the border of the mandible and covers most of the of your neck. So skin, superficial fascia, platysma. Now remove all of these structure. You will reach to the deep fascia. Look at it. This is the deep fascia. Let us open it like that's shown in this figure. So open the deep fascia, then you will find the facial vein, and the cervical branch of facial nerve. You know the facial nerve, which is cranial nerve number 7, we'll talk about it in the pituitary gland, divided into 5 branches. One of those branches is the cervical one, which is moved toward the neck. So this branch is the cervical branch of facial nerve. Okay, what else? You will find also submandibular lymph nodes. So what else? Okay, here is the submandibular gland. This is the facial vein, of course. And what we can see here, look at the facial artery. It's like tortuous artery. Look at it, it's like that. So the facial artery is tortuous. Now, at the first, the facial artery is located deep to the gland, right? But it emerged between the lateral surface of this gland and the lower border of the mandible here. Deep to this area, guys, deep in this at this region of the mandible, but deep from inside, there is an insertion of the medial pterygoid muscle, right? So they explain it sometime like that, that the facial artery emerged between it was deep to the gland, right? And it emerged, guys, from between the lateral surface of the gland and the lower border of the mandible, or you can say the insertion of medial pterygoid, and it becomes lateral to the gland, as you see here. Then it ascends up on the face. Okay, what I will see you guys here. Okay, here's also the facial artery. Look at it, it's like becomes like that and becomes lateral to it. I know I'm talking about the inferior lateral surface. These structures, the skin, superficial fascia, and the platysma muscle that embedded in it, and facial vein, guys, here, and a cervical branch of facial nerve and lymph nodes. Well, if you find it difficult to memorize it, just remember that in our body we have skin, superficial fascia, and muscles, then deep fascia, then we have vessels, vein and artery, and nerve and lymphatic nodes. So that's the easier way to remember it. Now, that was about the inferior lateral surface, but let us be specific and just see the structures located lateral to the gland. Okay, this is the superficial part of submandibular gland. Okay, laterally we have the facial artery, guys, and the insertion of medial pterygoid muscle here, and the submandibular fossa, this space, submandibular fossa of the mandible, that's located here, guys. These are laterally. Now, importantly, we have in the inferior figure, look at it, this is the submandibular gland. Medially, we have two muscles, simply two muscles. Mylohyoid muscle, you see this muscle that divides it into two parts, deep and superficial. Back again. So we have mylohyoid muscle and we have hyoglossus muscle. You know, the mylohyoid muscle, which is mainly, you can say medially and you can say a little bit anteriorly, right? This is the gland, so that divides, of course, here. So this is a mylohyoid muscle, guys. So we have two muscles. Okay, look at it here again. Let me erase these things. This is the submandibular gland. This is, of course, the superficial part, and this is the deep part, divided, of course, into deep and superficial by the mylohyoid muscle. This is the mylohyoid, which is located anterior and medial to it. Okay, so let us again, this is the mylohyoid muscle, and this is the hyoglossus. There are a couple of structures between the submandibular gland and the hyoglossus muscle. Structures here, guys. Let us study those structures. So the easier way to study those structures is to study the structures, the lateral relation of hyoglossus muscle. What does it mean? Okay, this is the hyoglossus muscle, right? Okay, and the gland should be here, right? Right? So there are structures between the gland and the hyoglossus muscle. So what those structures, guys, located lateral to this muscle and medial to the submandibular gland? Okay, those structures are, guys, styloglossus muscle. This is the first thing, which is the muscle that's originated from the styloid process of the temporal bone and inserted blended in the tongue. This is the first thing, styloglossus muscle. Okay, what else? We have two nerves. One is up, the lingual nerve, and one is below or inferior, which is the most important nerve, which is the hypoglossal nerve, cranial nerve number 12. Okay, we have a muscle, styloglossus. We have two nerves. One is superiorly and one inferiorly. The superior one is lingual nerve, which is a branch of V3, mandibular branch of trigeminal nerve. And inferiorly, we have the hypoglossal nerve. And of course, if you look to the hypoglossal nerve, you will see that's accompanied with vein, which is the deep lingual vein. This is the deep lingual vein. Of course, the deep lingual vein united with dorsal lingual vein to form lingual vein. However, so what we have until now, we have styloglossus muscle, lingual nerve, hypoglossal nerve, cranial nerve number 12, deep lingual vein, and there is very important structure here, which is the submandibular ganglion. We'll talk about it after a couple of slides, or at the end of this lecture, when we talk about the innervation of submandibular gland. These structures are located between the submandibular gland and the hyoglossus muscle. And I would like you guys to remember that the lingual nerve and the hypoglossal nerve are located lateral to the hyoglossus muscle. Lateral to the hyoglossus muscle. But at the same time, I would like you to remember that, on the other hand, that the lingual artery, you see this artery, which is a branch from common carotid artery, the lingual artery and the glossopharyngeal nerve, cranial nerve number 9, those two structures located medial or deep to hyoglossus muscle, deep to this muscle. Okay, let me erase it. So you have to know, which is very important, what's the structures related lateral to the hyoglossus muscle, lateral to this muscle, and what's the structure deep to it. When you say structures lateral to this muscle, that means they are located between the submandibular gland and hyoglossus itself. And deep to it, you have to remember the lingual nerve, the lingual artery, and the glossopharyngeal nerve. cranial nerve number 9. Okay. Just remind you, we talked about this muscle, which is the hyoglossus muscle, that in the previous lecture when we talked about the muscles of the tongue. But it's good to iterate that this muscle originates, guys, from the upper border of the body and the greater horn of hyoid bone, and inserted in the side of the tongue. And its function is to depress the tongue when it's contracted, and of course it's innervated by the hypoglossal nerve, the cranial nerve number 12. Okay, so again, this is the anterior end of the deep part of submandibular gland, and look, from there is a submandibular duct that passes under the mucous membrane in the floor, on the floor of your mouth. And guys, it passes between another gland, which is the sublingual gland. So it passes between the sublingual gland and the genioglossus muscle. It passes all the way to the front until, look at it here, until it reaches, or until they reach, because we have one on the right and one on the left, until they reach the frenulum of the tongue and open there with two openings of a submandibular duct. So guys, what else I have to mention is the lingual nerve. You remember that, and you have to know that the submandibular duct is crossed laterally by the lingual nerve, which is important during the surgery to that duct. You have to remember that, and it's important. Yes, I think still we have to talk about the innervation of the submandibular gland, but I will leave it to the end of the lecture after I finish the sublingual gland. Let's talk about another important salivary gland, which is the sublingual gland. From its name, you can conclude that it's located directly under the tongue. However, guys, the sublingual gland is located in the sublingual fossa, under the just directly under the mucous membrane that forms the floor of the oral cavity. So guys, let us be a little bit specific. If you look here, guys, you will see this is the frenulum. That's okay. And laterally under the tongue, you will see there is a kind of a fold of a mucous membrane here and another one here. This fold of a mucous membrane is known as sublingual fold, and under the sublingual fold, you can see, of course, if I will erase this, you will see here, guys, the sublingual duct of the sublingual gland that has many openings, that between 8 and 20 openings for the sublingual duct. So, as I mentioned, they lie beneath the mucous membrane, or what known as sublingual fold here, guys, of the floor of the mouth, close to the frenulum. And just I would like to remind you that the sublingual gland is similar to the submandibular gland. That means they are mixed gland. They have serous and mucus acini. So back again to the sublingual gland. and you can see here's the guy. As you can see, guys, the ducts for the sublingual gland. And although I would talk more about the nerve supply for that gland and for the submandibular as well, but for now, just keep in mind that the secretion from sublingual gland is under the effect of parasympathetic system, in which the parasympathetic secretomotor supply is implemented or performed under the effect of facial nerve, not directly from facial nerve, but by its branch, the what's known as chorda tympani, and of course through the submandibular ganglion, which is important. Now, the postganglionic fiber from this ganglion will pass directly to the gland and stimulate it for secretion. A little bit about the relation of sublingual gland, in which, you know, this is the sublingual gland that's located in the sublingual fossa, and these are the numerous ducts that secrete into the floor of the oral cavity. However, this is the left sublingual gland, and there is another one from the right, which is located lateral and say anterior to it. So posteriorly, this is a sublingual gland, and posterior to it, you will find the deep part of the submandibular gland. So the deep part is located posterior to it. Now, medially, I think you remember that we mentioned that the submandibular duct passes between the sublingual gland and genioglossus muscle. We mentioned that at the beginning of the lecture when we talked about the submandibular gland, right? So that means, and we also mentioned that the lingual nerve crosses the submandibular duct laterally. That means what we have medially, or what are the structures medial to the sublingual gland, they will be the submandibular duct and lingual part of lingual nerve and genioglossus muscles. These three structures located medial to the sublingual gland. Now, laterally, you know, there is a fossa here, which is the sublingual fossa of the mandible. Superiorly, you know, guys, that the gland is just covered by a mucous membrane. It's just located under the mucous membrane that forms the floor of the oral cavity. So superiorly, there is a mucous membrane of the floor of the mouth, and you know, the gland forms a kind of a fold. I'll try to see. Okay, let me show you here. Maybe. Yes, this fold, which is the sublingual fold that has a numerous opening for the opening of sublingual duct. So now when we have an inferiorly, which is pretty easy, you know that the mylohyoid muscle forms the floor of the sublingual gland. Now, what about the blood supply and venous drainage? Blood supply, guys, mainly for the sublingual gland is achieved by the sublingual artery. This is the sublingual artery, which is a branch of lingual artery itself. This is the lingual artery, and this is a branch of it. It's known as sublingual artery. No sublingual artery because it supplies the sublingual gland. Also, it takes its supply from an artery known as not sublingual, known as submental artery, which is a branch of facial artery, right? Known as submental. So we have sublingual and submental arteries, those supply the sublingual gland. Now the venous drainage, mostly the same. The blood from the sublingual gland will be returned by lingual vein, guys, and the facial vein. So lymphatic drainage, where the sublingual gland is very close to the submandibular lymph nodes, and also it drains into deep cervical lymph nodes. Let us talk about the nerve supply of salivary gland. I will start, or for today I will talk about the nerve supply of submandibular and sublingual salivary gland. And for secretion you need a parasympathetic effect, parasympathetic stimulation. So it starts from the brainstem, where is a facial nerve nucleus that known as superior salivatory nucleus. From there is a parasympathetic fibers pass through the facial nerve, and from there, so the facial nerve is important here, right? So the parasympathetic fiber from facial nerve passes, it has now two routes, one is up and one is below. Now keep in your mind, guys, that the salivary glands above the oral fissure, this is the oral fissure, the opening of your mouth. So salivary gland above the oral fissure will be, the fibers will be transmitted through the greater petrosal nerve, which is a branch of facial nerve. But salivary glands below oral fissure will be, the parasympathetic fiber will be transmitted through the chorda tympani nerve. That means, for our case, we are talking about submandibular and sublingual glands. They are located below the oral fissure. That means the preganglionic fibers will, from facial nerve, will be transmitted through the chorda tympani. From chorda tympani, guys, the fibers of chorda tympani will join the lingual nerve, and you know that the lingual nerve is a branch of V3, I mean mandibular nerve, which is a branch of trigeminal nerve. However, the chorda tympani now join the lingual nerve until it reach the submandibular ganglion. This ganglion is parasympathetic ganglion. Now, once the parasympathetic fibers reach the submandibular ganglion, the synapses will happen there, and from there the fibers will reach to the submandibular gland and also to the sublingual gland. Now also, of course, there's fibers continue with the lingual nerve until it reaches its target other than those two glands. So now what else? That was about the parasympathetic in the blue color. Now let us look to the red color. Represent the sympathetic fibers. Look at the sympathetic fiber from spinal cord around T1 and T2 spinal nerves. The fibers, I will use the red pen, the fibers will ascend until they reach a sympathetic, not parasympathetic, sympathetic ganglion known as superior cervical sympathetic ganglion. That's located in the neck. From there, these fibers, guys, will create a kind of a plexus around the vessels that supply those glands, I mean the submandibular and sublingual glands. So mainly they will create a kind of a plexus around the facial artery here and also around lingual artery until they reach their target. So in this slide, I will just iterate what I mentioned to you guys before about this ganglion that known as submandibular ganglion. It is, first of all, it is parasympathetic ganglion. That means it receives parasympathetic fibers or pre-ganglionic parasympathetic fibers. And as I mentioned earlier, it's located lateral to this muscle, lateral to the hypoglossal muscle, right? So this ganglion, as I mentioned in the previous slide, receives fibers from the chorda tympani that joins the lingual nerve until it reaches the submandibular ganglion and gives post-synaptic parasympathetic fibers to submandibular and sublingual gland or glands. So in the last slide, just in the first paragraph, I would like you guys to know that not just the submandibular lymph nodes can be swollen, but also you have to remember that there's a gland there. There is a submandibular salivary gland there, and can be, for a pathological cause, can be swollen. And also, guys, you know that the sublingual gland has sublingual duct and openings. So any of these openings under the tongue, of course, can be blocked, and this blockage, guys, can create a kind of a cyst in under the tongue. So guys, thank you for listening, and hope you find value in it. So the next time the next lecture, we'll talk about the parotid gland. Thank you.